I think it's wise at any stage, if you have cystic fibrosis and you're seriously considering having children in the not too distant future, to have the women seen by a gynecologist who does some work in infertility, because it's actually hard to predict ovarian failure early. There's some ways that we can predict it, but it's overall it's really hard to predict ovarian failure in women. And yes, overall, you should try to avoid having children in your late 30s because it becomes much harder. But there are a few people who are in their early 30s who will act like they're in their late 30s. So I think it's important, if you're considering having children, say, in 2 years' time, it's probably worth looking at doing some basic investigations for the women right now to see if you're compromising your chances by waiting the 2 years. So one quick example is if a woman is 29 years old, waiting 2 years generally shouldn't be considered too much of an issue because the pregnancy rates at 31 or 32 overall are not much different than they are at 29. But there are some women who do go through early ovarian failure, and it might be advisable to try to pick them up earlier, particularly if you're thinking of planning your children for 2 years in advance. So I think it's still worth it. I mean, it's a huge investment in emotional time and financial investments. If you're considering having children in sort of like the next couple of years, I think it's worth just going in and finding out now if it's wise to wait or not.